she's saying apart from the prolonged labor, I don't know if you understand, what other things can make the baby go into distress, right? That to start having meconium in the womb. Now, normal pregnancy is like 40 weeks. Now, but sometimes you will give a woman scan, she will go and tell you, even when she's up to 41 weeks, she will tell you that now the scan is saying plus 2 weeks. That thing is not plus 2 weeks, it's plus or minus. So it might be before 2 weeks or after 2 weeks. It means that their calculation might be wrong by 2 weeks before or 2 weeks after. Now, but if that person now have her last menstrual period, he can correlate the two and be sure when actually is her expected day of delivery. But once the expected day of delivery has been known, after 40 weeks, the blood supply to the placenta will reduce. Then the baby's blood requirement will increase. Let's assume that before the placenta was giving 100 ml of blood. At 40, and the baby might just need 70 ml. So each time the baby have more than enough. Is it clear? Now at 40 weeks now, the placenta might give 70, while the baby now need 80. Now the baby has started needing more than the placenta. That now push out to what we call placenta insufficiency. It's no longer delivering as much as the baby needs. Now, if that baby stays to 41 weeks, the baby's blood requirement will increase. The placenta blood supply will keep on reducing. It keep on reducing. Now, if you now go into labor at 41 weeks or 42 weeks, even when the labor has not been prolonged, the baby is likely to have meconium in the womb. I don't know if you understand. Now, apart from prolonged labor, the position of the cord, if there is cord around the neck, maybe 2 or 3 times, the moment there is contraction, the blood supply will be reduced. And the worst of it is what we call the true knotting of the cord. In that true knotting of the cord will just like that. The moment the woman starts going into contraction, sometimes it doesn't give the woman chance for the heart of the baby to change. The baby will just go. In fact, that one, the highest miracle that will happen to the woman is for her to know that there is no contraction. Because once there is contraction, the contraction is squeezed, right? If you squeeze the cord, the blood supply to the baby will be reduced. And anything that reduces the blood supply to the baby will actually cause the baby to poo in the womb. So apart from that, there are so many things that can cause it. But there is one that doesn't even cause that, and the baby will die.